I think you're
I'm,
muted. There we
yep,
go.
I made that same mistake 2 weeks ago. Yeah. Yeah, so I'll start off again. So good evening, everyone. Thank you so much for joining us this evening on this installment of Sowing Seeds, where we're going to be talking about Residency 101. First, I would like to welcome our two panelists, and I would love for them to introduce themselves to you guys.
I'll take Elder's privilege and start first. Hi, everyone. My name is Crystal Nora. I am a current adolescent medicine fellow. I graduated from residency now last year, where I completed an internal medicine and pediatric residency at the Johns Hopkins University in the Urban Health Residency Program. Before that, I went to medical school at UT Houston and college at UT Austin. I'm super excited to be with you all tonight.
Hello, everyone. My name is Stephanie Wagu. I'm a current resident, OBGYN resident at the Johns Hopkins, just like Crystal. And prior to that, I did medical school at the University of Colorado School of Medicine. And then I got my master's of public health at Harvard Chan School of Public Health. And then I went to Baylor in Waco, Texas for undergraduate. And so I'm also really excited to be back home with SNMA. Was really involved in SNMA back in my med school days as the national chairperson of the board of directors. So it's always wonderful to come back home and represent this amazing organization.
All right, beautiful. Once again, thank you both so much for taking the time out of your busy schedules to speak with us today. We definitely really appreciate that, and we look forward to hearing all the insight you guys have for us. So like my first question, just to kick it off, is like I wanted to ask, how'd you both come about choosing your specialty, and what factors influence your decision?
I'll
Please.
defer to you. You go first.
Well, I always knew I was going to go into obstetrics and gynecology. As an undergraduate student, I got the chance to shadow. There's not that many Black OBGYNs in Colorado. And I happened to just know one of them who was willing to take me on as an undergraduate student to shadow her for a summer. And I thought it was the most amazing job ever. Like we had like clinic in the morning, and then she would in the afternoon go and do a C-section, and then we would also like go and do a tubal ligation. We would do pap smears. We would talk to people about breast cancer. It was like the whole gamut of a woman's lifespan. We were able to just pack it into one day, and I just thought that was so amazing. I knew I was never going to get bored if I did obstetrics and gynecology, and I just love taking care of women. Like I think OBGYN is really special in that pregnancy also is just very special in that most people are covered by insurance when they are pregnant. So it's an excellent opportunity to get people who would not otherwise interact with the healthcare system anyways, and get them really plugged in and get them into good healthcare while they're pregnant, with hopes that they will continue it later on throughout their reproductive years and beyond that. So I just love like how wide the gamut of OBGYN is. You get clinic, you get surgery, you get a little bit of medicine, but not too much. I'm biased, but I think it's the perfect specialty.
What I'm hearing you say is that you loved all the things that you can do. And I'm like, oh my gosh, that's why I did med peds. I love all the things that I could do.
Exactly.
I was like, wow. So I came into medical school knowing that I wanted to be a primary care doctor. I really loved the idea of like going to a grocery store, going to like a soccer game, going like just being in the same community in which my patients were. And I didn't even know that my pediatrician was actually trained at peds, but I liked the idea of like just taking care of everyone. And so I actually joined a bunch of family medicine organizations coming into med school, went through my clinical rotations, did internal medicine. I was like, oh my goodness, I love this. I did surgery after that. And I was like, cannot do this. I'd rather go see the patients. I did pediatrics after that. And I was like, oh my goodness, I loved it. Then I did family medicine. I loved it. Then I did OBGYN. I was like, I loved it. But what I loved doing was delivering babies and not being in surgery. And I go through each of my rotations. I was like, I like too many things. Like, I know for sure that I don't want to do like a surgical specialty, but like, what do I do now? And I think for me, it came down between like family medicine and med peds. And I wanted a little bit more flexibility as far as like if I wanted to do fellowship, what kind of policy work. And I knew that I wanted a stronger peds presence than was available to me in family medicine. And I think that's kind of how I decided on the field. And I wouldn't look back. I think med peds is a smaller field, right? You're choosing to do two different residencies kind of in like one training period. But it's great. Like you go to conferences and you just know people because the field is small. And so it's a great community. I love it.
Yeah, thank you both so much. Definitely loved hearing the passion about both of your fields and what got you both into both of them in the first place. Um, so I wanted to ask the next question. So you guys kind of alluded to it a little bit, but what does a typical day look for both of you as a
It's,
resident and as a fellow?
I think like typical is hard to say. I think it kind of depends on like what rotation I'm probably on. So in residency, like I might say like a typical inpatient rotation. If I were to just do, yeah, inpatient, regardless if it's peds or medicine. So I'd wake up in the morning, probably around like 5 or 6, get to the hospital. I'm pre-rounding on some of my patients. So those are patients that have been admitted overnight or that have been there for a couple of days. I'm talking to nurses, I'm checking vitals, I'm like checking in on my patients. And then we round kind of earlier in the morning, around like 9 or so, where the whole team gets together and we kind of go and visit each patient room. And that kind of takes us to that like noon hour or so, in which we kind of break for our noon conference. And then we get some type of educational experience that happens in that noon hour. And then the rest of the afternoon is like trying to do patient care. So calling consults, doing med recs, admitting new patients, a variety of clinical things, whether that's also learning, teaching, educating. We're doing that in the afternoon and then wrapping up in the evening. On medicine here at Hopkins, we do 24-hour calls. And so your day may be extended if you're on call versus on peds, we do day and night shifts. So you might actually sign out to someone who's coming in for the night. So it looks a little bit different, kind of depending on what kind of system you're in. But that's kind of maybe a typical inpatient day for me.
Yeah. So just like Crystal talked about, is like we have different things for different rotations, and your day might look very different depending on what rotation you're on. So like a typical day on labor and delivery, for example, you'll come in probably around 6 a.m. and see all of the patients who have recently delivered a baby who are now postpartum. And you'll see those patients and just make sure like breastfeeding is going okay. You talk to them about like if they want birth control, those type of things. Talk to them just about their postpartum healing process. That includes people who delivered vaginally and people who delivered via C-section. You might see more complex postpartum patients who have like other medical issues. And so you're talking to them about those medical issues as well and coordinating their care. Then at 7 a.m., we kind of have like a sign out where we discuss all of our postpartum patients. We discuss all of our patients who are coming in for like their induction of labor or their scheduled C-section. The patients who are currently laboring. So we talk about those patients and what's going on with them. And then you go off and you do your scheduled C-sections. There might be like 2 a day that you're doing. You do your scheduled C-sections and you come back and you kind of help out on the labor floor. Maybe like someone needs their water broken, or there's a patient who came in labor who needs to be seen and evaluated. Or, you have a patient who's pregnant who needs a CT scan for whatever reason, and you're just coordinating their care while they're pregnant. So that's like a normal day on labor and delivery. And then at 7 p.m., we then switch shifts. And so it kind of starts over every day. We also take every once in a while or every other weekend, we take like 24-hour calls too, where you're doing that in the morning. And then you continue doing like labor and delivery because babies get delivered at all hours of the day and night. So there always needs to be somebody there to deliver the baby. So that's what our typical day looks like on labor and delivery. And then that changes quite a bit for each rotation that you're on. And a lot of it will look just like Crystal said. If you're like on a GYN oncology service, it looks very similar to like we see our patients in the morning, we round, and then do patient care and coordination of care in the afternoon.
Yeah, thank you both so much for sharing that. Before my next question, I just want to say to everybody in the that logged on. If you guys have any questions, you can put it in the chat, and then I'll bring it up as the next question. So my next question for you guys is, so what surprised you both the most about residency?
For me, the answer is really easy. What surprised me most was the sheer hours that you spend in the hospital. No one, everyone knows that residency is hard, but I feel like you don't really understand what that means until you're in it and you really learn what 80 hours a week working is like, and you're just like, oh my gosh, I didn't know I could stay awake for 24 hours and do all this stuff and still be in tip top shape at the end of my shift and do a C-section right before I go to bed, and it's that was very much a shocker for me. That was like something that I wasn't expecting. And probably the hardest part of residency is just the sheer hours of labor that you're putting in. And I think residency is that way by design, fortunately and unfortunately, that we just learn. There's so much to learn in that brief period of time that they pack it into your days. So you just keep working and you just keep learning. So that was definitely a shock to me.
I think I have to echo the hours is just a lot of working. And so I think there's some things that people were like telling me and like things that like I advise like my mentees on like how to choose a program or like how do you choose a specialty. And it's like you have to figure out like what are the things that you hated about each specialty? Like which one do you hate the least, right? Like there are all parts of our jobs that we hate, but like would I rather spend like 80 hours like doing like Steph's job and like being like, okay, like the worst part, like, it's so hard, right? Like you have to think about like what are the things that I can tolerate and I can't tolerate doing for like such an extended period of time. And so I think the hours are like such a big thing. And then I think also I recognize this as a medical student, but like maybe not to the extent of how much I'm also doing a lot of educating. Like I'm educating my patients, I'm educating medical students. There are people who are coming to shadow. You're like, and then like that interdisciplinary, like I'm not just talking to physician, I'm interacting with all sorts of members of the healthcare team. And so I don't know that I appreciate it to the extent of collaboration and education that goes into the job, which I absolutely love. I just think as a med student, you're like, okay, I've got my one patient. I talked to like the resident about it, but then I didn't see like, oh, you're calling the CT tech, you're like talking to the nursing, like you've called pharmacy, like you've consulted another service. Like I don't know that I was exposed to like just like how much collaboration there was, which has been a really exciting part of my job.
Yeah, so and I guess like echoing that or like building off of that, like what are the biggest what are the biggest challenges you both faced during your intern year and how did you handle them?
Oh, I have a couple. Challenges come. Residency happened, but life still happens like with it. And so I started residency in the midst of the COVID pandemic. And so I think there was like a lot of isolation. I think the first one was like neglecting my own mental health, quite literally, of being like, oh, like these are the things that I did to take care of my mental health. And then just decided like, I'm a doctor now. I don't need those things. And I definitely needed those things. And so I think neglecting like my therapy, like taking medication, like those kinds of things where I was like, it's fine. It wasn't fine. And then had some family members who experienced a lot of like just really difficult things in their own health. And so to the point of like, you're working hard, everyone's working really hard. How do you like try to advocate for taking time to go deal with family things? And like, how do you do that when you feel this immense pressure of like, I have to be in the hospital, I have to be working. And like, thankfully I have like supportive leadership who like, once they heard like, oh, like your family members in the hospital, like pause, how do we get you to where you need to be? But I think even with supportive leadership, sometimes like trying to articulate that you need help when you've kind of been in this position where you're like, I feel like I'm doing so many things on my own. And like, I want to be able to take on this burden, but sometimes like asking for help is really hard.
Mm-hmm. I would echo everything that Crystal said. Like it's really hard being an intern. I think another point that I would add to that is also just feeling like, when you're a fourth year medical student, you kind of feel at the top of your game. You've taken step 2, like all of medicine, you feel good, you've like graduated medical school, and then you get to residency and you're like, oh my gosh, like now I need to learn how to like put in orders. Now I need to learn how to tie a knot, like, you know, and like now I need to know how to actually do the surgery. Like I know the steps of it. I've seen it a million times in medical school, but like now, like they put the scalpel in my hand and like, what am I supposed to do with it? I thought that was a really like hard transition as an intern, just being like from the observer to the doer, and like having that responsibility now be on you as like now you're the doctor, and like the nurse asks you a question, you're like, oh shoot, I have to be the one to I have to be the one to answer that because I'm the doctor. So that was a really hard transition because I felt like, well, of course, like you're an intern, so like you have lots of supervision, so you're never alone. But sometimes it felt like, oh my gosh, like, am I really qualified to put in this Tylenol order? I don't know. Am I going to put this person in liver failure? I don't know. So like it was just really hard to like actually like switch my mind over to like now like I'm the responsible agent for these patients. I'm no longer just the medical student. And so I thought that was really hard as an intern, like building up that confidence and like being bad at stuff. Like well, the first time and the first couple of times you do something, you're going to be really bad at it. Like it's going to take you. I remember this one time I'm writing a note that I saw a patient in clinic and I didn't know that my chief was timing me. And then I finished my note, I press like submit, and then my chief goes, Stephanie, that note took you 45 minutes to do. It should only take you 8 minutes. So like what's going on? And like it kind of like it sucks feeling like you suck at something. And so that was really hard as an intern, being like, oh my gosh, there's so much to learn, so much to do, and it's hard to like not be perfect. And so that was a really big and steep learning curve as an intern. And still as a chief resident, like I still feel like, oh my gosh, like there's so many things I need to learn how to do before I go off and become an attending. And I feel even my first couple of years, even my next couple of years as an attending, I'm still going to have that learning curve. And so that's why like medicine is a practice. You know, you're always practicing, you're always learning, you're always getting better.
Yeah, I thank you both so much for that transparency. And just one question: what is your biggest advice for how us as medical students can mentally prepare for the transition into residency?
I think don't worry less about the clinical stuff. I think everyone like comes in and they're like, oh my goodness, like the biggest, like to, you know, Stephanie's point, like the biggest hurdle is going to be like my knowledge. Like I have to like go back, read every single book. Like I have to learn things. I mean, like if it makes you feel better to like read a couple of chapters or something, or like listen to a podcast, like by all means, like do it. But like I don't try to cram all of your knowledge into like a particular time frame, right? I think the things that you can help prepare yourself to the transition is for me is like trying to figure out who your community, your network is, and like plug into that like actively and now. So like thinking about like, are there ways that I can get into regular rhythms of checking in with my friends? Because I know that's going to be that much more difficult when I'm like working for however long. Is there like, for me, like I love photos. So like I spend a lot of time just printing photos. So like when I got to my new place, like I would just have pictures of like loved ones around me. I really recommend people just kind of figure out like, what are the institutions? So whether that's like finding a faith-based, you know, home, if you know people in the area that you can start to connect with, think about like how to build your network because you're going to need them when it starts, and worry less about like trying to like compensate for like, oh, I forgot everything. I feel like a lot of people start in the same place. So think about ways to kind of protect your mental health and your well-being.
Yeah. I would take, especially fourth year after you've matched and all of that kind of stuff, just like take time to rest, because you don't realize like residency hits and it hits hard. And so you're going to be like, oh my gosh, I don't remember the last time I slept for more than 8 hours. I don't remember the last time I slept for more than 6 hours. So use that time that you have as a fourth year resident and just get rest. Spend time with your loved ones. Check in with all of the people you haven't been able to check in with while you were like studying for STEP or whatever it was. Just like take that time. I know lots of people like may feel the need to go ahead and study. Like Crystal said, if it makes you feel better, you can do that. But I promise you, there's like no amount of studying that you do before residency starts that's going to make you like, it's not going to make intern year suck less. I just like, there's nothing that you can do. The only thing that you can do is like come into intern year very well rested with your like with a nice scaffold of structure around you to make sure that you're going to be successful.
So my next question, so I guess like switching the conversation a little bit towards like the application process and like matching process. Um, so what do you think you both did that made your residency application stand out for your respective specialties?
Well, I'll defer to the board over here first.
So for me, um, for residency applications, it really is telling a story. Like, I definitely had a story in medical school that showed that I cared a lot about diversity, equity, and inclusion work, that I was a growing leader in my organization. Like, I kind of just did one thing in medical school and then I just did it really well and stuck to it. That might not work for everyone, but like I told a story. Like, I joined SNMA as a pre-medical student and I just like kept going. And then like by the time I was done with SNMA, I was the chair, I was running things, I was doing a lot of high level things that like a lot of people don't have that kind of like corporate work on their resume. And so I had that, and like I was already plugged into organized medicine. So that like is what made me stand out as an applicant. So I had maybe a little bit of research. I didn't have any like first author publications, but I felt like I didn't need it because I like had all this other wonderful stuff on my resume. When it came to like clinical rotations, it really depends on what specialty you're going to, and a lot of places are transitioning to like you have to have an away rotation. I personally did not do any away rotations, mostly because it was COVID. And so I couldn't do any away rotations. So I had to make my home rotation like really count. And so the climate for that has changed. And so if you do get the opportunity to go away and do a sub-I somewhere else, that would be really great, especially if you're coming from a school that like not that many people may know your school. And it kind of sucks, but prestige kind of matters. So if you go to a school that like, say you're applying OBGYN, and you go to a school that people don't really know that program and they don't know the OBGYNs there. They don't know, like that program's not really known for their OBGYN. You might want to go do an away rotation where at least people know who the OBGYNs there are. And if you do an away rotation, you have to kill it. You literally have to kill it. And so I like tell people, make sure you do your home rotation first if you can, like really like set yourself up for success, take away any like stressors that you can, and like really, really put your head down and really grind during your away rotations if you're going to do it, because an away rotation can make or break you. And I've seen it do one or the other. Like even with people who do away rotations with us, like there's some people who come and like knock it out of the park, and there's some people who are like, oh, I don't know if I'd want them to be my co-resident. So you really just want to make sure, like if you're going to do those away rotations, like you really have to show up and show out. And then other things that you can do to boost your applications to make sure you match, knowing the specialty. Like I would say, like if you know you're applying dermatology, you know you're applying ortho, you know you're applying ENT, like really try and get your like publications out there. Have a work at least submitted. Like if you're going to do a project, make sure you have something to show for it. Like you can't just say like I did so and so research project. Show that you submitted it somewhere, and maybe it hasn't been like accepted somewhere yet, but at least like you have a work that is complete and can be shown to other people. People really look for and admire that. And then like, you know, research, community service, it's kind of like, unfortunately, it's kind of like an algorithm. I mean, of course, the match is an algorithm, but like sometimes like getting into residency, just like getting into medical school, is like, can you beat the algorithm?
Mm-hmm. I find like Stephanie's just so smart, so I'm just gonna agree with everything that she says. Like if you tell me what numbers to play in the lotto, like I would. I think the biggest thing in addition to that is I think I had an idea of what mentorship was like supposed to be like in medical school, and like And now that I'm like gone through residency, I'm in fellowship, and like I have my mentors and I see like who has been like really great mentors to me. I cannot stress to you the importance of you as a mentee looking for good mentors, keeping those mentorship relationships going and cultivating them. Like you need to have near peer mentors. So like the person that you saw in like the SNMA meeting who went on to do your specialty, like that's the person that you need to be talking to. And that person for me was Louis Seha. Didn't even go to my medical school, but like had literally outlined the path for like applying to med peds. Like he was like, these are the classes, or these were like, the things that I did. This was the kind of experiences that I had. This is where I applied. This is like, how I responded when I didn't hear back. Like he literally created an outline for folks who are applying for med peds that I've been able to add on to and then send to my mentees, and they've been able to add on to and send to their mentees. Like that near peer mentorship that's going to tell you like, hey, like I just went through this process and that is like not going to work, or that's absolutely going to work, or they're going to ask you this question, like be prepared for this, or this is what they want to see, is going to be super important, right? Because as a med peds person, I can tell you how to be competitive in internal medicine and pediatrics, but my same type of advice is not going to hold for someone who's doing derm or ortho or even like OBGYN. The next thing is then also thinking about having people who are a little bit more senior in your career, and also like making sure that they're looking over your stuff, that they're giving you not just things that you want to hear, but things you need to hear. And I think we have sometimes a lot of like fear of people telling us like, hey, like you can't do things. And so, sometimes it's hard because you're like trying to like pull it away from like, is this truly good advice? Is this biased advice of like, that pre-med advisor who said I would never be a doctor or anything like that? You've got to find people who are on your side, on your team. They're going to be able to guide you and be like, okay, like I see that you've got these couple of reach programs. It's going to benefit you to like go to like think about these other programs. Or, hey, like I don't know that you have highlighted the fact that you've done so much work in SNMA. Like this is how you need to craft your personal statement in a way that it really sells a story that you're trying to get. And it's like easy to think like, oh, I have mentors, but like mentors should be like editing your personal statement, like thinking about your CV with you, like planning things out. And if you're like, oh, I don't know that I have anyone in my life that's doing that for me, absolutely not too late, but that also doesn't happen overnight, right? So that's what I'm saying. Like, even if you're like a first year medical student, like start to like reach out to people, set up routine meetings. Like those are the kinds of relationships that can get you from like, okay, maybe I have a solid chance to like, oh no, there's someone who's on my team who's going to work as hard as I am to make sure I get to the next step and where I want to be.
And I see part of your question was how many programs can you list? That's really going to be specific to your specialty and your specific application. So I would reach out to your mentors, reach out to the people who have done it before you. Like just how Crystal said, I had people who had just applied. Luckily in medical school, I took a gap year. So all of my cohort had already gone through the match process, and I asked them, okay, how many programs did you apply to? Like these were video interviews. Like what was that like? And so they applied to 50, so I applied to 50, and so and I was able to like show that to my I think my clerkship director at that time, and I was like, is this an appropriate number of schools to apply to given my competitiveness or not? And so definitely that's all going to depend on your specialty and then your specific application.
Mm-hmm.
Yeah, thank you so much that was very, very a lot of insight right there, and definitely a good point on mentorship, near peer mentorship, and then mentorship that's more advanced with those that are more advanced in their career. Another question that I had is, how did you approach ranking programs for the match?
A prayer, lots of prayers, actually. I think some of it to points earlier made is like trying to, I think people are like, oh, try to play the game and whatnot. When it comes to ranking, I feel like you just have to go with your gut. And you have to know like, what are the things that, because as much as you're evaluating programs, like, as much as programs are evaluating you, you're evaluating programs, and you have to go and put down your rank list in a way that makes sense for you. So if family is like truly important to you, then like rank the place that's like closer to home. If there's like an opportunity or a city or a partner that you're trying to be in the same city with, like those are absolutely valid things to take into consideration. And it's like unfortunate that our like medical system is such a way that it puts such high pressure, like such pressure around like these decision points of like where you're going to go. And I, speaking for med peds, like there's so many wonderful programs that I could honestly see myself being happy in each one of them. It just would take different things and have different interests. And so I think for me, specifically when I tell people in med peds, I'm like, match where your heart desires. Like put that rank list in like what you think is really important to you, not like trying to be like, oh, well, maybe if I put this program here and they promise me this, like don't play those games because you still have to live with where you ranked, right? And the algorithm will do what the algorithm does, but just go with your heart. And then for me, once I certified my rank list, I had really great advice. I said, don't touch it again. Like you will wake up in the middle of the night being like, no, I can't do it. And those moments don't stop. So like just put in your rank list and then like let it be.
Yeah, as I was interviewing for programs, I know like some of my medical students had like really like big spreadsheets and they would assign numbers to certain things and all that kind of stuff. I literally would have a little notebook. I'm very type B. So I would have just a little notebook that I went to every interview with. And then on one column, I said vibe check. Did they pass vibe check or not? And so like, that was like literally my way of deciding. I was like, ooh, they don't pass a vibe check. Not ranking. Well, I ranked everyone, but like not ranking highly. And so another thing that I did is after each interview, I would call a trusted person. And for me, that was my mom. And so after every interview, I would call my mom and be like, Mom, this is the things that I liked about the program. This is the things that I didn't like about the program. And we would just be talking back and forth. And my mom was also making a rank list based on how excited she thought I was about each program. And so at the end, me and my mom compared our rank lists and it was actually very similar. She was like, oh yeah, when you talked about Johns Hopkins, you like lit up, you were so excited. You like didn't even care that it was in a city that you didn't like you like really loved the people there. You wanted to take care of Black patients. And so that's why you went there and all of that stuff. And so like, having someone who also understands you and your heart and your desires and like talking through that with them, or like you're like, oh, do I really like this program is like a top name program and I didn't feel right there, but I'm like, I need to put them like top, my top 3 because like who wouldn't want to go to this like high named program? And then like I would talk to my mom and she was like, remember how you say you hated it? Yeah, I don't think you should rank them highly. And so just having that like back and forth with someone else who like really knows you well was really helpful for me.
I did the notebook thing too. And then I think after each interview, I would also just like, I was making a rank list as I went. Cause then after like, cause you also like during like the interview process, things kind of get like, whoa, like what did I like about what didn't I like? They start to like sometimes like all like the spiel sounds like a lot of the same. And so you're like trying to remember like, oh, is it this program or that program? But it was nice to like go back and see like throughout like, okay, now that I've heard this program, where does this fall in my rank list? And so then I could kind of go through the end and see the ways that I was moving my rank list around. So it didn't feel like I was waiting till the end to like sit and make this like decision with all the programs that I interviewed at.
Yeah. And I also had kind of like a method where I had a baseline program. Like I was like, if all else fails, I would be happy at my home program because I know my home program. And then I would put like, I would say, I would compare each school to my home program. I was like, would I be happier at this program than my home program? Okay, then they go up higher. Would I be in like, I just had like one x-axis and they would be the one that I would like rank all the schools based off of. And so then I at least knew I was like, okay, at the end of the day, if I end up at my home program, I will be happy. And so like, where does everyone else fit in that?
My next question, if you could redo the application process, what would you do differently at any step along the process?
I probably would have started earlier. I'm a
Mhm.
procrastinator, so I like definitely I didn't have enough time to like have all the people I wanted read my personal statement. And so I just didn't give myself enough time. I think that's the only thing I would change. And I think hindsight is 2020, but I think I over applied, but I think I'd rather over apply to more schools than I needed to than under apply and then be scrambling for interviews. So those are the only two things I would do differently, but it ended out okay for me.
I think like I said, like I was given this like beautiful scaffolding of like how to like go through the process. It was like literally this like beautiful spreadsheet that like listed out all the programs, like what I needed to like, and I just had to kind of plug in my programs and like what they needed to keep me well organized. I think things that I wish I like just having like a master calendar. Because sometimes like you would be like, and I'm sure it's still this way, but like some programs schedule their interviews in very different ways. So some places are like, we're going to give you all the list, and then everyone is going to email the next day at 8 a.m. like what your top, preference is for like the dates to come and interview. Some places use programs to like, special like third-party programs to like schedule your interview. Some people use the AAMC. So there's like so many different platforms. And I think I would sometimes get lost in all the dates and trying to make sure I got like the best one for me. And this is back when we were flying to all of them. So you had to like be like, oh, okay, like if I'm flying to this state, well, I'm going to try to get an interview in this date too, so I don't have to like try. So there's a lot of coordination that goes in. So I think I probably would have just had like a big master calendar. And that way I could be like, okay, like the programs like I'm really hoping to hear from, I know that their interview dates are this days and this day. So I might like try to save those dates and like have like a bigger idea of like when things are happening. But other than that, I was pretty happy with like how organized my friend was able to kind of make me going into the process.
Okay, thank you both for that. So I guess now I'd like to transition um, regarding I guess like the skills and like adaptation for residency. So my first question with that is like, what are the most important skills a new resident should develop earlier on? And I know that's like very specialty dependent, but I want to open up with that question.
Go for it.
Well, I was going to say getting comfortable relaying clinical information is, I think that goes for any specialty. You need to be able to tell someone else what is going on with your patient, what question you have about the patient, or what your plan is for the patient. Like just getting really good at your oral presentation skills is really important because as an intern, you're going to be talking all the time as
Mhm.
about your patients. You're going to be putting in consults and calling consultants and like asking the consultant questions. You're going to have to learn how to be like, tell them, like if you're talking to surgery, you're talking to OBGYN, like what is it that you need at this second? Like I don't have 10 minutes to listen to the entire how many puppies the patient has. Like, I want to know like succinct what is going on with this patient and what is your question for me. And so being able to really get the nitty gritty down about your patient and figure out what's important and what's important information to share. So I think that's a really good skill. And even if it's not like clinical wise, like being comfortable talking out loud to people, and like you don't have to be a great public speaker or anything like that, but you do need to be comfortable in your voice, like being heard, like communicating like what's important to you and what your plan is. I think that's a really good skill that I've found that not everyone has when they come to residency. And so just being able to communicate effectively, especially when it comes to patient care.
I feel like you threw the puppies bit in as a shade to the pediatricians out there who do ask how, and I'm very curious. And I note this is why my notes take 45 minutes. I put each of their names and whose dog is it? Okay, it's your brother's dog. Okay, cute. That's in all of my notes. And
I actually do have a great time reading the notes of the pediatricians and internal medicine doctors.
I'm running between my important C-section cases. I read Crystal's very long notes about the patients that we share. No, I absolutely agree. And I'll add a value to the skill that you provided, which is one of integrity and trust. And I'll give a skill afterwards. But I think one of the biggest things you have, especially as an intern, if you don't have a lot of things, you have your word. And so never say that you did something that you didn't do. Never say you checked in on a patient that you didn't check in on. Like, no, don't like your word is it. So like when you're learning to communicate, did you go see that patient? Yes, I didn't, or no, I did not. Right. Because I think intern that I worry about are the interns that I don't know that I can trust their word. And with that skill that I'm going to pair it with is like being able to ask for help. And it is hard because, as Stephanie said earlier, you come off of this like MS4, you just have like clinical knowledge, like you feel like, or like you have book knowledge, you feel like I'm on top of it. Like I know where everything is in this hospital. Like I feel great. Like I know where things, and you have all of this confidence. And I feel like so much of intern year shakes that confidence. And then I think sometimes in attempts to regain that sense of like who we were, like walking around like our med school, like feeling like we're big stuff, is like we may start to like, oh, overinflate things or like say things that we're afraid of like, what if people know that I don't know? Right. And so like, oh yeah, like I listened and I didn't hear that when you didn't listen, right? Or you might try to make all these shortcuts. And I've seen it happen, unfortunately, in some interns. And so I would say, like, if you don't know, like we're literally in residency to learn. So I'd rather someone say, hey, I don't know versus no, I didn't hear that murmur, right? And of course, like you're an intern, so people are always double checking your work, but you don't want to build a reputation early of being someone who's unteachable, and being someone whose word you can't trust, because those are really hard professionalism things that are going to be hard for you to shake and really impact your career development. And when you don't know, it's always a challenge of like, okay, and this is how I'm going to like learn that knowledge. Like, oh, you know what? I actually don't know what the next medication is to treat this person who's in decompensated heart failure. I'm calling my senior, but then I'm also taking a listen and I'm learning from what they're doing. And so being teachable is going to be really important, because you will, if you knew how to practice medicine, why go through a residency? You would just be working, but you haven't. So people have an expectation that they're going to teach you those things. Don't make it hard for them to say like, I don't know, and be willing to learn.
Yeah, so that leads into my next question. How do you handle like difficult attendings or co-residents or even patients as well?
At Johns Hopkins, there are no difficult attendings. There are no difficult co-residents.
Sorry, can't let you finish. But continue. Oh, everyone's just peachy and has 3 puppies.
Everything is so fine. Why would you even ask that question? But difficult attendings, I feel like it's, well, now that I'm a chief resident, I feel like now I'm interacting with the attendings more. As an intern, you're more so interacting with your senior residents who are like somewhat shielding you from the craziness that is some of the attendings. But honestly, just remaining teachable and like not letting things just let everything roll off your shoulder. Like don't take anything personal. Like a lot, like you forget that these attendings and like your senior residents who might be having a bad day, they have lives too. Doesn't mean that they should like treat you poorly or like talk to you crazy. But just remember, like everyone is going through something outside of this hospital as well. And not everyone has the best like communication or like teaching style, or like sometimes like they might have a teaching style that works really well with someone else and it doesn't really work well with you. That's fine. You guys just don't gel. But don't let like anything don't let things be a personal attack. Like everything is their problem, you know? And so I tell the interns all the time, like, you know, don't like, yes, it's okay to cry and all of that kind of stuff, but don't take anything personally. Like you are here to learn. Of course, as an intern, you're not going to know things and people might have harsh words for you, or it might come across as harsh when they're trying to give you feedback about those things. But just remember, like, stay teachable, and like let things roll off your shoulder, because like if you let them stick, you're going to be carrying around a lot of weight that's going to bog you down the entire residency program. And so like just I tell people, just don't take things too personally. And that's really helpful when you're dealing with co-residents, attendings, and then just like come in like with a good attitude every day. Like people love like literally, if an attending is talking to me crazy, I'm sitting there looking at them smiling. Like you can't talk to me crazy for that long if I'm staring at you smiling, you know? Like it, like just be teachable, and they'll be like, oh, okay, yeah, Stephanie, like she has such a good attitude about everything. I guess I'm gonna re-show her how to tie that knot that she messed up 4 times, you know? So like just be teachable, and like people remember that about you. And like I think that's very helpful when dealing with like more difficult attendings or like senior residents.
I think from like the patient perspective, like your point of like people are going through this, like their own thing. And sometimes it's helpful to remember, especially when you're seeing patients who are like in the hospital setting, like that you are interacting with people at like either, you know, sometimes the happiest moments of their life, right? Like they're getting fantastic news, or the worst moments of their life, right? Or like just moments that like, who wants to voluntarily spend their time admitted to an inpatient service, right? And so people are bringing a lot of those experiences and they're frustrated. Like, imagine if you were in a hospital room, couldn't leave, people are coming in all the time. You don't exactly know who these folks are. You're eating the food, which isn't that great. Like, that's a lot of stress that we put people through. And it's all because we care, right? Like, we want to make sure that, you know, we're getting good care and like we're doing all the things that we need to. But it's tough being a patient and then also being incredibly vulnerable. Like, that's your body. Like, this is your health. Like, this is, and, you know, you have all these people who are coming in. Like, so I think it's like helpful to like remind myself. And I think I deal with this a lot, especially when I'm interacting with caregivers and patients, especially on peds, is like just remembering too, like this is their loved one. This is their everything. And they may demand things that we just know aren't reasonable. Or they may find, you know, that like, oh, like the way that you talk to, like, I think you just got to remember, like, this is a patient who's in a really vulnerable state. And some of it is just like taking it and just being like, okay, boom. And then I think it's also recognizing who your allies are in that space, because sometimes people will cross the line. And I've seen that. And, you know, whether that's like a senior that you really trust, whether that's an attending, even if they're not on your direct, like whether that's your program director, I think you've got to kind of throughout residency, figure out who are the people that really look after me, because there are sometimes that things need to be addressed. Like, okay, like this is Dr. Nora, like as she said, like she's the physician that's going to be taking care of you, right? Or like I remember being absolutely chewed out by a fellow as an intern and feeling like really low, and like an attending walked over and was like, you absolutely cannot talk to her that way. And I felt like really supported. And so find the people that can back you up, because sometimes it is just like, you know what, they're having a really bad day. But then sometimes you're like, oh, like I should not also be treated like this. Like I'm also working really hard with like best of intentions and finding the people who can be really supportive. And I'm also not above reporting things. Um, and sometimes it changes things and sometimes it doesn't. But I feel like in that, you know, obviously it takes a little bit of position, power, privilege to feel like you're in a position where that's not going to come back and get you. But if I'm not having a good experience with someone, I'm like, I don't know that it's necessary for other people who look like me. And sometimes too, like what I'm talking about is like that race-based, like this is like inappropriate, right? Like I remember having a patient who's like, I don't know how you got into Johns Hopkins, right? Or like my so-and-so tried to get into this program, they couldn't, how did you get in? And being like, okay, that's not gonna slide, right? And so I'm not above being like, someone needs to address this and it doesn't have to be me. So find your allies when you need to.
Yeah, thank you once again for both for the like that transparency. I know that's definitely an important topic that especially as medical students, when sometimes we're like there's the hierarchy and then there's not uh like knowing our place, like when to be able to speak up and whatnot. Yeah.
Mhm.
So I guess my next question, kind of switching the conversation to like more like career and like future planning. So I want to ask, how has residency shaped both of your career goals?
I guess I'll go ahead and start with that one. So, like I said, I came in, I did internal medicine and pediatrics. I didn't think I was going to specialize at all. Like the folks in my program, if we do specialize, do addiction medicine, do a lot of policy work, do all sorts of things within the realm of like urban primary care, HIV, Hep C kind of care stuff. And I did a rotation on adolescent medicine, and I was like, oh my goodness, I love this. It's like sexual reproductive health. It's like chronic disease, it's planning, it's all the primary care things that I love within this like age range. And then throughout like residency too, like, you know, you get a bunch of emails, and I happened to read one about someone who just needed someone to help out on a sickle cell project. And I was like, sure, I'll do that. Ended up loving the work, loving the type of research that became like my primary mentor, like the person that I would like go on and publish with. And now I'm like, my career has shifted in a place where I'm really interested in taking care of young people with sickle cell disease and thinking about what does it look like to live well with a chronic disease. And so that has like opened up so many doors for me, and like thinking about what it is to kind of like develop this like expertise. And so that's been really exciting, kind of see my career kind of go from this like, I'm not sure if I'm going to specialize, to like, now it's like I still get to be a generalist, but I get to have this like very specific content area. And then it allows me to like enjoy the other things that I'm really interested in outside of medicine too, just kind of given my work-life balance. And so never thought I was going to go in this direction, but I'm super excited that I am.
Yeah. For me, I'm choosing to practice as a general OBGYN after residency, but I do have like thinking about my future career, I'm trying to transition into like a physician executive, hospital administration, that type of line of work. And honestly, I didn't realize that that's where my life was going, but it was always happening. So like when I did, and it's a testimony to like kind of look at where you fall sometimes and like look at what like you're naturally good at, because I did an undergraduate internship. And I randomly applied for this internship. I thought I was going to be hanging out with doctors. And instead of hanging out with doctors, I was hanging out with the vice president of the hospital. It was a small hospital, but it was a vice president. And like, she taught me the ropes of like what it looks like to run the hospital from the underground. And as an undergrad, I was like, oh, this is kind of cool. I'm just doing this to put it on my resume, whatever. Like, are you going to write my recommendation letter for medical school? And then I get to medical school and I'm doing like all of these like leadership projects and like all of this stuff. And then like now, and then I was a chair of SNMA and I was like, oh my gosh, I'm like doing all of this like really cool, like higher order executive work and strategic planning and organized medicine and all this stuff. And I was like, I kind of just fell into this, but it's like, I just kept falling into those kind of roles, and I was learning that I was good at that type of stuff. And I was like, maybe this is like what my calling is. Like, there's a lot of things that go on in the hospital that I do not like. And I feel like in my current position as like, even if I was faculty, I would not be able to change those things. But you know who can change it is the chief medical officer of the hospital. And I know like a lot of people do lots of really great like advocacy work and like want to go like and do politics and like advocate to our politicians and like do make change that way, which is great. I like have tried that before and I've gotten really frustrated with it and I like cannot do that type of work. But I found that there's a lot of really great advocacy that you can do within a hospital institution that like I feel like is really untapped potential for like especially Black women, especially like OBGYNs, for any OBGYN in the room, because we understand surgery, we understand inpatient, we understand like clinic. So I think like OBGYNs are really, really good at running hospitals, but we are so busy and tired that we don't do it. So I kind of like fell into that career path. And so that's kind of where I'm going to do like a fellowship in that and transition out of clinical work eventually to do that full time.
I just know you're going to be running a hospital that I'm employed at. So just remember me. Remember me now, friend.
Literally, I don't even think I've told Crystal this, but I remember because Crystal is a couple years ahead of me, and I remember seeing her like match day photo, and she was like, "I matched at Johns Hopkins." And I was like, "Look how happy she is! I want to match at Johns Hopkins." And so I was like, "I just want to be where Crystal's at."
Well, you made it, and may you surpass me. Amen.
Yeah, that's wonderful. That's wonderful. So I guess like one of my last questions, what do you wish you knew before starting residency that you know now?
Oh, there's so many things that I did not know starting residency that I just don't even know how to answer that question.
There's like so I think yeah, I'm like, oh, there's so many lessons, so many things. I like things to invest in, buy a house, girl, like all the things. I think nothing is life and death unless it's life and death, in the sense of like residency will, if you let it, take every part of your life. It will convince you that you can't eat healthy because you don't have time and the only thing you can do is rely on free food in the hospital. It will convince you that it's not worth it to like take the time to figure out how to exercise because you have no time. It will say that you can't call your sister or your aunt or check in into them. You can't make your friend's bachelorette party. You can't go to the wedding. You can't make those things because you have no time. It will tell you that you cannot do your hobbies because you have no time. It will take up every single part of your life and your identity if you let it. Now, that's not to be naive and say that you can do all the things all at the time, all at once, and that there doesn't come compromise or things, but like, I wish I would have pushed harder against residency taking over things in my life. And so I think it wasn't until like maybe my 4th year when I realized like, oh, like, yes, it can be a little bit more difficult to like plan out the trip to go see the friend, but you can do it. People do it all the time. They like just swap schedules and that just means you have to know maybe a couple of weeks of time to like, this is something to start planning, but it doesn't mean it's impossible. Like, yes, eating healthy can be difficult, but you can do it. It just may look a little bit different. Like my 2-a-day workouts that I could do in med school maybe looks like 3 to 5 times a week. And that 3 times 5 is like, it's like a walk around the neighborhood twice. And that's what I got. So just remembering like there are core parts of who you are. Determine what's core, what's non-negotiable, like put that in first, let residency fall on top of that, and then you can still claim other parts of your life. This does not have to be the only thing you can talk about at a happy hour, right? Like you can do other things, not all at once, but you can do other things.
Mic drop. I don't have anything to add. That was great.
Yeah. Thank you both so much. I guess like since like just to be like respectful of everyone's time, I know you both are very busy. I want to give you guys like an opportunity to give like any like closing statements or like any like last minute like advice or anything you'd like to share to everybody that's listening tonight for all of our listeners and viewers.
Yeah, I would like to share, like, at the end of the day, you can do it. And you are the prize. When you are applying to residency programs, remember you are the prize. Like they want to fill their residency spots because they need people to work and take care of patients. So you are the prize. And you have so much to offer, no matter what this political landscape is telling us about affirmative action. And we don't belong in the spots that we can't take up space. Like they are wrong. Don't let that like influence you at all. Like you belong, you are qualified, and you are going to be an amazing doctor no matter what people say. As long as you put in the work, as long as you care about your patients and do what you need to do to become clinically competent, socially conscious, and what's the other one? There's another one in the SNMA mission statement. But oh yes, clinically excellent, socially conscious, and culturally competent. So as long as you're doing those things, like it's in the SNMA mission statement, as long as you're doing those things, you are going to be an amazing doctor, and do not let anyone tell you otherwise. Like you can do it.
I'll leave it at the SNMA mission statement. I love it.
All right, beautiful. Thank you once again, both so much for sharing all of your wonderful insight. I know me personally, I've learned a lot from our discussion and session today. Definitely learned to look into Johns Hopkins a little bit more, the way you both were selling it to me.
Come on down.
Great people.
Yeah. So definitely gotta look into it more. So once again, thank you both so much for taking the time out of your busy days to speak with us, share your insight. And I also want to thank everybody that was listening to us tonight, that was able to watch this installment of Sowing Seeds. I look forward to seeing everybody in the next installment in 2 weeks. And I hope you both have a wonderful evening.
Okay. Thank
Absolutely.
you.
Good night.
Yeah. Good night. Thank you.